nowadays hearing impairment is actually in the rise. Is it because of increase of awareness in the general public, or because of the availability of technology, as in more hearing centers are open throughout Malaysia and so on? That is one of the factors. According to a report on hearing by WHO in 2021, 1.5 billion people globally are affected by hearing impairment, which by the year 2050, they expect to increase to about 2.5 billion, which is quite high. Not only for adults, even for pediatric populations in newborn, there's a prevalence of 3 in 10 newborns which has hearing impairment. That is why since end of last year, Ministry of Health Malaysia has started the universal hearing screening program throughout Malaysia, which has ENT department. So out of about 54 ENT equipped hospitals, 48 of us are actually doing universal hearing screening. The rest are doing targeted screening for those who are high-risk babies. So what does hearing loss mean, and what can it do to the patients or the general public? Okay, you might find hearing loss is not a very severe disease. It's not as bad as cancer, hypertension, and so on. But when you see more patients and we ask them, hearing loss can actually cause mental illness, depression, dementia, and also social isolation. So how about hearing loss in work, at the workplace? Meaning the hearing loss is caused because of the work that they do. Okay, noise-induced hearing loss is one of the highest occupational related disease in Malaysia for the past 5 to 10 years. Okay, so what can it lead? It leads to reduce in productivity, school performance for kids, unemployment, and ultimately loss of income. As you can see, this is a statistic by our SOCSO annual report. From 2005 to 2014, year by year, the number of cases reported for noise-induced hearing loss is increasing. This is the latest data for 2021. Out of all the occupational disease category reported, 60% or 3,648 cases are purely occupational noise-related hearing loss, meaning patients are exposed, the workers are exposed for prolonged duration of noise at their workplace, which ultimately cause hearing loss in them. So this was an article published in Curious in 2023, where they specifically looked at noise-related hearing loss among vector control workers. So out of 379 vector workers that were interviewed and done audiometry testing, nearly 50% was found to have noise-induced hearing loss due to their work. So before I talk further about noise-induced hearing loss, I'll talk a bit about the anatomy. Okay. Okay, as you all know, this is our lateral view of our ear, which consists of outer ear, middle ear, and inner ear. So the outer ear has our external ear canal where the wax is produced, and as much as we have advised all our patients, using cotton bud is not suggested. Okay, when you use cotton bud, actually you can push the earwax further in, which can actually lead to hearing loss because of the sound is unable to reach the inner ear. The middle ear consists of our 3 main ossicles for hearing, which is the malleus, incus, and stapes. And of course, our inner ear, where the cochlea is, which contains the cochlear nerve, is there, where it aids to transmission of our noise or sound converted into impulses sent to our brain for us to perceive sound. So how does sound travel? As I mentioned earlier, imagine this is our external ear canal. The sound passes through the tympanic membrane and it starts to vibrate. Once it starts to vibrate, the vibration will be transmitted through all these ossicles to the cochlea. Okay, it will be transmitted through the cochlea. The base is for high frequency sounds and the apex for low frequency sounds. So if you imagine any wax or any disease at the middle ear or outer ear can cause to hearing loss in patients. So this is an example of our pure tone audiometry which we have done in patients. The one on the left is a conductive hearing loss. Conductive hearing loss means there's a problem with the conduction. It can be due to middle ear effusion, it can be due to impacted earwax, or even muscular discontinuity. Whereby you can see the upper line here is the level of their sensory hearing level, and down here is the conductive. So when there's a gap between the sensory hearing level and the conductive hearing level, we call it conductive hearing loss. On the right is the sensory hearing loss, whereby you can see both the graphs are in tandem. So at the lower frequency, the hearing is almost normal, but at the higher frequencies, there's a dip. So most of the time, we can see this kind of PTA pattern in presbycusis patient or in old age patients. So as I mentioned earlier, noise-induced hearing loss. Noise-induced hearing loss, as we know, is quite highly reported. There's a study saying that 22 million people are exposed to noise hazardous working environment, whereby 4 million of them will eventually develop noise-induced hearing loss. So noise-induced hearing loss can be categorized into sensory neural hearing loss or acoustic trauma. Acoustic trauma is when a person or a worker is exposed to sudden blast or sudden noise which is more than 140 decibel. So any noise higher than 140 decibel, even one exposure, it can lead to acoustic trauma and eventually sensory hearing loss. So you might ask me, 140 decibel, what kind of noise? For example, jet taking off, Formula One racing, fireworks, it's about 120 to 140 decibel. Anything higher than that, it causes acoustic trauma. For sensory hearing loss, by definition, anyone exposed to more than 85 decibel for 8 hours for a prolonged duration, it can lead to noise-induced hearing loss. Okay, noise-induced hearing loss, not necessarily you work 1 week, immediately you will develop hearing loss. There's a thing called temporary threshold shift. Temporary threshold shift occurs when you're exposed to the hazardous noise for a short period, but when you stop exposure, within 16 to 48 hours, you tend to get better. Permanent threshold shift is when, for those who are working years in hazardous noise conditions, whereby their inner ear, the cochlear nerves, due to the metabolic stress and oxidative stress, it doesn't recover. So we call it permanent threshold shift. So this is a hallmark of noise-induced hearing loss. You would see the dip at 4K notch. 4K is the high, because most of the time noise-induced hearing loss occurs at the higher frequencies. So this is a telltale sign of NIHL or noise-induced hearing loss, whereby you can see a dip at the 4K level. So whenever we see patients with this, we will immediately suspect NIHL and we will inquire further about their working conditions, duration of exposure, use of PP at their workplace. So this was a very good article. Actually, it's a meta-analysis of about 11 articles, which actually looked into the prevalence and contributing factors of occupational noise-induced hearing loss in Malaysia. So from the article, they have identified various factors, but the most common is age, working with noisy machineries or longer duration of employment, exposure to the level, and also the duration they are being exposed to. Duration of exposure, intensity of the machines as well. These are all the contributing factors that can lead to noise-induced hearing loss. Age, usually male are more predisposed to hearing loss. So sometimes it's not just the matter that the husbands don't want to listen to the wives. It's just that sometimes there is hearing loss, so they can't hear what the wife is saying. Okay, sex, same here. Age. Anyone more than 40 years old is exposed to, or is predisposed to hearing loss, whether it can be genetic or also due to their work environment. Predisposing ear disease. For example, you like to use cotton bud, you cause tympanic perforation, which leads to ear infection. So those who have chronic otitis media, the chances of them getting noise-induced hearing loss is higher. Also, genetics. If say there's a family prevalence of hearing loss in your family, there is a higher chance of you developing hearing loss. Whereas patient's habit or ear hygiene, like I mentioned, using cotton bud, going swimming and not cleaning your ears afterwards, use of PPE, most of the hazardous working environment, the workers will be supplied PPE. It can be earmuffs or earplugs, but the failure to use or not using it properly or not using it all the time when they're being exposed to the noise can lead to hearing loss. And also exposure duration. Yes, the definition goes by 85 decibel for 8 hours a day. But you have to realize that when the noise gets higher, the duration that leads to hearing loss becomes shorter. Meaning that, say, for example, you're exposed to a sound level that is 90 decibel or higher. So it's no longer 8 hours per day. It becomes shorter, 4 to 6 hours maybe. It depends on your working condition, and it also depends on your exposure level. So usually the occupational health doctors have already established, according to the working environment, how long patients are allowed to be exposed. So what do we do? First of all, prevention. Okay, prevention can be primary prevention where you prevent hazardous working environment. You try to muffle the sound with soundproofing and so on, or you provide your workers with personal protective equipment such as earmuffs or earplugs. Secondary prevention is when patient has already been exposed, you stop from them getting worse. This is usually done in the factories or even quarries where they have annual screening of their workers to identify high-risk patients and to stop the exposure and to offer hearing rehabilitation for them. So hearing rehabilitation can be done via hearing aid or cochlear implant through surgery. Okay. So this is what, for example, the prevention notices or how you put up adequate warnings at the factory or working environment where you remind remind workers to wear adequate PPE and also supplying them with earmuffs or earplugs. Okay, earmuffs, it is able to reduce it's effective for about 60 to 70 decibel. Earplugs is lesser, about 40 to 60 decibels, because why? When you use earplugs, the noise still being exposed to your outer ear. So there's still vibration to the opposite side, and it gets transferred to the inner ear via vibration. So ideally for high noise level working condition, we suggest that patient use earmuffs and earplugs as combined. So this can have protection up to about 70 decibel. So these are examples of hearing aid that we can offer to patients. Okay. So this is an example of behind the ear hearing aid. This is usually used for moderate to profound hearing loss because it's a high powered hearing aid. The one on the right is in the ear hearing aid, which is not as effective as behind the ear, but patients prefer this because it's aesthetically more pleasing. The general public don't know they're wearing hearing aid. Other examples of hearing aid is in the canal or completely in the canal. Okay, in the canal and completely in the canal, yes, it's small, but the drawback for this kind of hearing aid is their level of this one is only about mild to moderate. So patients who have anyone having more than moderate hearing loss, this would not be helpful to them. When, say, the traditional hearing aid doesn't work, we can offer patients bone conduction devices such as Baha soft band. This is usually used in peds patients, but for adult patients, it's usually percutaneous or subcutaneous Baha attract. But bear in mind, one of these will cost about 28,000. So most of the patients are a bit hesitant. But this is the best for those who are having very bad level of hearing, such as profound hearing loss, when the external hearing aid does not work for them anymore. So this will be the next step. Other than that, the ultimate step will be using a cochlear implant where you implant the whole device into their cochlea, the electrodes go into their cochlea, and there's a receiver outside at their temporal bone area. Okay, that would usually cost about 80,000 ringgit per side. And most of the time, for now in Malaysia, cochlear implant can only be applied for children via the kebajikan. For adult patient, it's either through public donation or self-pay. So these are the examples of laws that are protecting us as workers or those who are outside. One is the OSHA Act 1994, Occupational Safety and Health Act, Noise Exposure Regulation 2019, Occupational Poisoning and Occupational Diseases Regulation 2004, Employers Social Security Act 1969, and Self-Employment Social Security Act 2017. Okay. So what happens when patients actually complain of noise-induced hearing loss? What do they do? So most of the time, once a patient, a factory worker develops noise-induced hearing loss, when they have approached the panel doctor or what, they would actually refer them to occupational health and also ENT. ENT will do a basic screening to rule out other causes of hearing loss and also examine their ear, nose, and throat for other contributing factors that can lead to hearing loss. And we will do a formal pure tone audiometry whereby we establish the hearing level. So once we have established hearing level, the occupational doctor would actually go to their working environment and use something called sound level meter. Okay, this is an example of sound level meter. They would actually go and measure the exposure of sound in the working environment. And then they will come up with a report saying that, okay, at this particular workstation, the sound exposure level was this, and patient was exposed to that sound. If say the sound level meter, the site visit does not show that patient is exposed to hazardous noise at their working environment, then their application for SOXO would be denied. So these two books is quite important for us in the SOXO board, in the medical board, because it has a clear outline of compensation and the percentage of compensation. For example, if there's an absolute deafness at only 1 year, it's only about 20%. When there's absolute deafness at both years, then only you get 100%. But actually deafness at 100% means it's highly likely to happen to someone because most of the time they will pick it up. We are able to pick it up before that. And the level of hearing factors is factored in based on their photonorimetry, and their calculation is done for whole person impairment, and the compensation is given accordingly. Okay. So other than noise-induced hearing loss, which can be due to the exposure of sound or hazardous noise in their working environment. Workers can also have other causes that lead to hearing loss. For example, if you're working in an aircon environment, you have a predisposition to allergy. Example, you're having allergic rhinitis, eczema, asthma, which can actually influence your hearing level. As you can see, this tube here is called the eustachian tube. Okay, it goes into our middle ear cavity. When this tube is connected to the nose, this is the opening of eustachian tube on the right or on the left. When you're having sensitive nose, which can lead to more secretion, the secretion which can actually enter through the opening of this eustachian tube to the middle ear cavity, causing the middle ear cavity being full with secretion. So this in turn causes middle ear effusion, which will also cause conductive hearing loss. So for example, if patient comes with reduced hearing and when we do examination and we find out that the hearing loss is actually because of conductive part of the sound transmission, we would treat the nose first. We would offer the patient intranasal corticosteroids, and also if it's repetitive middle ear effusion, we can offer them megatomy and Cromet, whereby this is a tympanic membrane with middle ear effusion. Like on the center, you can see there's actually bubbles seen. So what we would do is we would do a small incision at the tympanic membrane and we put in a small tube to drain the fluid. And most of the time, after doing this, patient has improvement in their hearing. I think that's all about noise-induced hearing loss. It's actually not a very big topic. Is there any questions from the floor?
Thank you, Doctor, for the wonderful presentation. For those who are not in the field of otorhinology, because most of our participants would be from the background of the laboratory. So maybe this is a new thing to be learned on. I would like to welcome the participants to ask questions to our doctor here. And to start on the question, I would just ask one or two questions to doctor. So my first question would be, in hospital setting, which healthcare worker more prone to hearing impairment due to their condition in the workplace? Because I think most of the participants are from the hospital side. So they would like to know, I think, who is more prone to hearing loss?
Okay, in a hospital setting, most of the time, those who are exposed to loud noise will be either the surgeons or dental technicians. Like if you go to a dental clinic, you see because of all the drilling and all, the dentists and the dental technicians, especially where they have lab doing dentures, where they have to shave the teeth, they have to drill, then there's actually a study saying dental technicians are one of the most prone. In healthcare setting itself, it's the vector workers where they do fogging, they are the ones. So in hospital setting, I'm not very sure about those who are working in lab because we are not very familiar with the kind of sound level that you guys are exposed to. But dental technicians and surgeons, example, ortho surgeons, or even ENT surgeons, especially otologists where they do frequent drilling of the temporal bone and all, they are the ones prone for hearing loss.
Okay, thank you, Doctor. We do have some questions from the participants. Here I can see Puan Mashita, she's asking, hello, Doctor, what is the proper way to clean the ears? So I think this is a very common question that because
Yeah.
we would see the cotton buds are being sold everywhere. So since you said that cotton buds are not advisable to be used, so what is the proper way to clean the ears then?
Let me just share the slides. Can you see the ear picture here?
Yep.
Okay. Okay, the ear canal actually can be divided into the cartilaginous and bony part. Okay, at the cartilaginous part, there's actually our small hair follicles which pushes out the earwax. So most of the time, our ceramon, our earwax is only produced at the cartilaginous part. So if you have a normal functioning cilia, our ear will self-cleanse. If you're having difficulties, instilling either olive oil or coconut oil once a week, 1 to 2 drops, is more than enough. Or there's also over-the-counter medications such as ceramol and sodium bicarb, which helps you to loosen the earwax so that it comes out naturally. If you see, because it's produced here, right? When you use a cotton bud and you clean it, you push it in blindly, you have a tendency to push the earwax inside to the bony canal. So the bony canal does not have the cilia to push out the earwax. So as days go by, you keep on using the cotton bud, you keep on pushing the earwax, it will be actually be infected. So which can cause pain, hearing loss, or for example, if you go swimming, when the earwax gets wet, it expands, it causes otalgia, ear pain. So what would be my advice is as an ENT surgeon, do not use cotton bud. If you're having blocked ears, try using any oil. I mean, coconut oil, baby oil, or olive oil. What you have at home, 1 to 2 drops a week. If you're still having problem, you have to you have to see a doctor or even ENT clinic to do a proper otoscope. There are certain conditions such as keratosis obturans where patients' earwax can't be extruded out. So those kind of patients, we have to do ear toileting every month or every 2 months. Or for example, those who have cholesteatoma, we have already done a major op whereby we create a big cavity with the EAC and middle cavity. We have taken out their ability to extrude out the earwax. We will see the patient regularly for ear toileting.
Okay, so indeed those days method works actually, because I think older days they were using those oils to actually clean the ears, if I'm
Yeah,
not
true.
mistaken, in some cultures. So I move on to the next question. Another question is, how frequently we need to do the hearing test?
Okay, according to the OHD Act, for those working environment that has hazardous noise level, it's a yearly assessment whereby the employers itself have to arrange a yearly screening for their workers. And say, if example, they are categorized as high risk, it will be 6 monthly. So a bare minimum is yearly screening for their hearing and their general well-being.
Okay. So if it's like that, how about the general public, doctor? For those who are really exposed due to their workplace, is fine. We have a
Mm.
yearly or 6 monthly screening. But how about the general public who are not actually exposed to this kind of factors, but are they encouraged to do the hearing test screening?
For a general public, if you are not exposed to the noise level, it's not actually something that you have to do yearly screening. Maybe if you are more than 40, or the moment that you have any hearing difficulty, your wife complains that you're not answering her back, those kind of situations, you encourage. But there's no, according to CPG or according to our recommendation, there is no reason for the general public to do screening as a precaution. unless you develop symptoms, you have reduced hearing. For example, uh, you can hear conversation, but in certain sensory factors, you can converse normally. But when you go to a noisy environment, sorry, you can't converse normally, but when you go to a noisy environment, you're able to hear properly. Then there's obviously something wrong with your hearing. So those are examples of patients that would need to do screening.
Okay. All right, Doctor. Another question. Hi, Doctor. What is the cause of small ringing sound in the ear? I think many old age patients also have this kind of complaint. Maybe you can give some explanation on this.
Yeah, okay. The ringing sound, we refer it as tinnitus. Okay, first, ideally, you would need to be assessed by an ENT doctor, because why? Tinnitus can be unilateral or bilateral. If bilateral tinnitus, then we are not so worried. But when it's unilateral tinnitus, as I showed in the... Okay, one of the main reasons why tinnitus happen unilaterally is because the eustachian tube is blocked. Okay, can you see the opening of eustachian tube? So when the
Yes.
eustachian tube is blocked, it causes unequal pressure between both the middle ears. It can lead to retention of fluid, which can lead to tinnitus. Okay, in these cases, especially in nasopharyngeal carcinoma, like the one that Lee Chong Wei had, that can cause tinnitus. So when you see an ENT doctor, we'll always do a nasal scope. First thing we have to rule out is any growth that is blocking the eustachian tube. Second most common cause in Malaysia is for tinnitus is because of allergic rhinitis. As I mentioned, it can cause the retention of fluid in the middle ear effusion, which can lead to tinnitus happening in either unilateral or bilateral. And after that, the most common is in old age, where they have tinnitus accompanied with hearing loss. These conditions we call it presbycusis, which is old age, hearing loss due to old age. In some patients, unilateral tinnitus also can be due to acoustic neuroma, which is the growth of a benign tumor at the cerebropontine angle. So we can't say tinnitus is harmless. It's best to be assessed by an ENT doctor or surgeon to rule out all these factors.
Okay, Doctor. I hope this is the final question. Hi, Doctor. What cause palpitations sound occur when too much noise received?
Palpitation sounds. Okay, there is a phenomenon called acoustic reflex by our inner ear and our tympanic membrane. For example, when you're exposed to a loud sound like a loud blast, if it absorbs the whole sound, either it can cause tympanic membrane perforation or acoustic trauma. So up to a certain level, our ear is able to compensate for that loud exposure of sound. So that's why when you are being exposed to a loud sound, instead of acoustic trauma or permanent temporary shift, a temporary threshold shift happens. So it's a compensation by our inner hair cells in our cochlea, which after being exposed to a loud noise, you have like a tinnitus, palpitation, or you might even have a degree of hearing loss for up to a day or 2 days. It's part of our compensation mechanism by our ears. So that one single event of loud exposure, we don't go deaf or our hearing is impaired.
Okay. So one last question to Dr. Daya. Actually, in your opinion, how good is the awareness about hearing impairment among young Malaysians in your observation so far? In the district, especially, maybe you can give an overview on that.
I think generally, especially after during the COVID era where everyone's being exposed to webinar usage of microphone and earphones, the awareness has increased. So they're more attuned to the degree of their hearing loss. Maybe it's increasing because of the increased exposure as well, and more patients are aware because one, it's more accessible now. Even in small towns, there are either ENT in government setting or at least a hearing aid center which being open across Malaysia. Because I have to admit, hearing aid is not cheap. Even the normal conventional one is about 2,500 and can go up to 8,000. So it's quite a lucrative business. So when people see more centers being opened up, they tend to have a curiosity of why so many centers. Maybe I should go and get my ears checked. But most of the time, yeah, it's because of the level of exposure has also increased in recent times.
All right, Doctor. So I couldn't see any other questions being posted in the chat box. So if participants do not have any other questions, I would like to thank Dr. Daya for giving his time to explain to us about this hearing impairment, something new to be learned. And I hope the participants had benefited from the talk today. So for now, we will adjourn, and thank you everyone, and thank you, Dr. Daya.
All right, thank you. If there's any questions, any of you want to send, this is my email, can email me anytime.
Okay.
I'm
And
able
also,
to help.
kindly the participants, please fill up the link posted in the chat box for your e-certificate, and also we would like to welcome feedback from you guys, especially for topics that you would like to hear in our sessions in coming times. And with that, thank you, Dr. Daya. Thank you all, and
Thank you.
goodbye.
Welcome.